I'm McCoy with Autism News Network, and I'm here with Dr. Charles. Where did you get inspired to work with autism?
Really what I was doing, I was working as a pediatrician and seeing children with developmental delays. And it was about the time, it was about 30 years ago, when more and more kids were being diagnosed with autism. So I happened to be just kind of in the right place at the right time. Some people from the Department of Disabilities and Special Needs and Autism Division came and we started seeing patients together as a team.
Have you seen the understanding of autism change over your career?
Yeah, I think people are a lot more aware of it, what the symptoms
Yeah.
are, especially teachers and parents and things like that. They know what to look for, and pediatricians too. We try to teach pediatricians what to look for.
What are your favorite sources of information on autism?
Parents.
Yeah.
That's where you learn the most, and that's what I tell uh, people learning about autism is listen to the parents and listen to the patient if it's a patient that is old enough to talk.
What kind of experience do you have with autism internationally?
About 20 years ago, I went with a psychologist and a missionary. We went to Russia and we gave lectures about autism and to actually a lot of them were nuns who took care of children with special needs. We traveled around and went to a number of orphanages um, that had special needs kids there and did some evaluations there. It was pretty cool. It was really cool.
What kind of experience do you have with autism at different conferences that you go to?
I've given some lectures at different conferences. I used to do a lot of work with a group of people that were counting the number of people with autism in South Carolina. So I did a lot of lectures about that, just giving them the information that we learned.
What is policy work and what policy work have you done around autism?
So policy is when you try to come up with guidelines on good ways to treat people. So I've been working with some policy groups really for about 15 years. One thing we did was this group I work with, we came up with a plan to try to get children, very young children with autism, into starting to get therapy very, very early, because what was happening is that they weren't getting their diagnosis until later, and they were missing out on a lot of different kinds of therapy. So we came up with actually turned out to be like a law, and that children could be diagnosed much earlier and get their therapies.
Yeah. What caused you to decide to go to medical school?
I was interested, I liked science a lot just in school, in
Yeah.
biology and chemistry. I was interested in being with people and talking with people, having an opportunity to help people if I could. That's kind of how I ended up.
Hi, I'm McCoy with Autism News Network here with Dr. Charles. Thank you for watching.